Hello, welcome back to my channel Breast and Beyond, where we'll talk about everything breast cancer and beyond breast cancer. My name is Wala Durimi. Today we're talking about two things. Number one, what exactly is breast cancer? And secondly, we're talking about the risk factors that may cause breast cancer. Please stay tuned to the end of the video so as not to miss anything we're going to be talking about in the video and for a very important information at the end of this video. So, what exactly is breast cancer? Simply put, breast cancer is a disease that occurs in the breasts when the cells in the breast grow out of proportion. Now imagine it like this: when the breast is growing, the cells in the breast have a control switch that tells them it's okay, stop growing. Now when this control switch has an issue, when it doesn't tell the cells to stop growing, these cells in the breast, they grow and grow until there's nowhere to grow to again, and then they form a clump or a lump, which is called a tumor. And this is what breast cancer simply is: cells in the breast that grow out of proportion till it forms a lump or a clump. Now, like I said, the second thing we're talking about are the risk factors. Now, these risk factors, we don't usually call them causes of breast cancer because they are actually risk factors. They are things that if it happens, you might get breast cancer, and if it happens, you might not get breast cancer. Now, these risk factors are divided into two: controllable ones and the ones you cannot control. Now, for the controllable risk factors, they are: number one, short breastfeeding. Now, short breastfeeding, what do I mean by this? There's some scientific evidence that if a woman breastfeeds for a shorter period of time, she may develop breast cancer. Like I said before, this does not necessarily mean every single woman that does not breastfeed long enough are going to get breast cancer. It only means that it may trigger breast cancer. Number two is obesity. When you're overweight, when you're way over the normal regular weight. Now, this is also controllable, like I said, and this does not mean every single big bodied woman is going to get breast cancer. It only means there's a higher risk if you are obese, if you are overweight. Number three is alcohol. There is a link between overconsumption of alcohol and breast cancer. Like I said again, it does not necessarily mean a woman that drinks too much alcohol will get breast cancer. It just means there's a risk, there's a higher risk when you drink a lot of alcohol. And lastly, for the controllable risk factors is contraceptives. Now, we all know that contraceptive deals with hormones in the body, whether it's estrogen or the progesterone and all of that, except one or two contraceptives that has nothing to do with hormones. Now, for these contraceptives, there are some of them that may increase a woman's risk of developing breast cancer. So, if you are at the age that you take contraceptives, talk very well with your medical practitioner to know the one that will reduce your risk for getting breast cancer. Now, these are the controllable risk factors. Now, let's talk about the uncontrollable risk factors. Number one is early puberty. Now, nobody can control this. Puberty comes when puberty wants to come. For some ladies, puberty starts puberty, and this puberty I mean period and all of those things. For some girls it started as late as 16, 17, and for some girls it started as early as 8 or 9 years old. Now, if it starts as early as 8 or 9 years old, there's a higher risk for that girl to develop breast cancer later. Higher risk does not mean that every girl that starts puberty early will get breast cancer, just that there's a higher risk of getting breast cancer if there is early puberty. Another one is aging. The older a woman gets, there's more risk of getting breast cancer. And thirdly, genetics. Breast cancer is not 100% genetic or hereditary, but if there's a history of breast cancer in a woman's line, in a woman's lineage, there's also a higher risk for the woman to contract breast cancer. Now, this, like I said, they are not necessarily that once you have all these things, you will get breast cancer or you will not get breast cancer. It just means there's a higher risk if all of these are put in place. Now, for my next video, we're going to be talking about the symptoms of breast cancer. Please like, comment, share, and subscribe to my channel. Now, for the tip I wanted to talk about, I've heard of these things a lot of time that is it only women that have breast cancer? No. men also get breast cancer. It's quite rare and it's more common in men that have a fatter body, men that are overweight. It's quite common, but yes, men do get breast cancer, not women only, just more common in women. Thank you so much for watching this video. Like I said, like, comment, share, and subscribe to this video to get more of this wonderful video. Thank you so much. See you in my next video. Cheers.